Many people think that if you have a mental health challenge, it has to look a certain way. But when anyone finally opens up on the experience, it's clear that these struggles can happen to anyone. Take Amuta, for example. No one knew what she was going through.
Interestingly, nobody around me really knew that I was going through it because I hid it really well. I actually looked the happiest then. I looked really happy. If you see my pictures, I was always smiling and happy. But when I go back and I'm by myself, that's when I really, really feel like it felt like I was in a dark space. That's how I would describe it.
Music helped her face her sadness head on. She found what worked for her and got the support she needed. And when COVID hit, many more had to face their mental health challenges and admit they needed help. NGOs like African Health Matters offered resources to address the underlying pandemic.
We were forced especially as a country within Nigeria, to be at this standstill where we had to actually come to terms with the things that we were dealing with, right? And I think as Nigerians, we're always told to kind of just go, work. But now we were in a predicament where everything was at a standstill.
We know that mental health is an issue that affects everyone and it cuts across all different types of classes. But what we don't know is what is being done on a policy level to make sure that this is systemic and that this issue is being addressed in a way that reaches everyone.
Some of the issues that we're facing. One is the actual bill title. The bill title is Mental Health and Substance Abuse Act of 2019. And the problem with that is that it continues to connect the idea that the reason why people have mental health conditions is because of drug abuse or substance abuse and things like that. And we know there's a variety of reasons why people have mental health conditions. There was a poll that was conducted in a report that came out in 2020 by Epicenter and the African Polling Institute. And it said that 84% of Nigerians believe that the leading cause of mental health conditions is drug abuse. Now, what were in a distant second and third, 60% had to do with sickness of the mind.
More men in Nigeria are stepping up as leaders to address the issue, hoping it'll take away the pressure men are under to always be strong.
As a Nigerian man, there are so many cultural perspectives that have sort of shaped so many traditions that have affected women, and it's like, so far you're a guy, you already have certain responsibilities that are not communicated to you, while growing up.
The data on mental health is low, largely because we're still learning how to see the early warning signs. And sometimes it may take a professional opinion to help us see what the issue is. But the thing to know is that feeling sad or worried for longer than usual may be a warning sign. And in a country as complex as Nigeria, we have a long way to go. But one thing is clear, a lot more people are recognizing it. Itoro Udofia, Arise News.